Hello, I am Dr. Kelvin. I'm a phys therapist. And if you wake up in the middle of the night with shoulder pain, or feel frequent pain throughout the day, this video is for you. In this video, I will show you the positions that you should avoid when sleeping, cause positions might be contributing to your shoulder pain. And I will also tell you what the right positions are that you should use for sleeping. These positions I recommend to my shoulder patients. For example, this combined with treatment helps these patients not wake up in middle of night with pain, helps with these patients improving their shoulder pain. So in this video, you will learn all of this. I ask you to leave your like, subscribe to channel, comment below. Which position do you find it easiest to sleep in? I, for example, usually sleep on my side. So comment here and look for comments from those who sleep in the same position as you. And let's get to video. Let's talk about the shoulder joint. So you can better understand this whole issue. What I call the main shoulder joint is formed between the head of the humerus, which representing with closed hand, refers to the longest bone in the arm, and the scapula. So these 2 points from each of these 2 bones come together. And then we have a joint. However, this shoulder joint is a shallow joint, and it needs to be in its place, especially when a person has pain, inflammation. Therefore, when you sleep in the wrong position, you might be compressing one side or the other, pushing where it shouldn't be pushed. And this can be aggravating, worsening pain conditions, making it difficult for the shoulder pain patient to improve. I have had numerous shoulder patients who improved their shoulder pain combined with the treatment that was prescribed. It's with these positions that I will show you. You will learn all of this in this video. So first, let's start by talking about the positions you should avoid. Do not wake up with shoulder pain middle of the night. The first position is sleeping, lying on the arm with the head on top of the arm. Let's say I'm already lying here, with the head on top of the arm. This position should be avoided at all costs, because this creates pressure here in the joint, in my shoulder, and we don't want that. This can be strangling some important muscles pass through here, in our joint. It can be strangling blood vessels, nerves, and the like. So waking in pain, you might wake up with a numb arm, because it is interrupting the nerve communication with the arm. I unintentionally have ended up sleeping in this position, and when I woke up, my arm was all completely numb, all limp. I couldn't turn off the alarm clock that was ringing, so this position should be avoided. The second position you should avoid sleeping in at all costs is, oh man, this is the worst. This is a major villain. It's sleeping on your stomach, especially when we sleep on our stomach with our arms upright. And to sleep on your stomach, to breathe, we need to turn our neck to the side. And there's a big problem, besides being a cause for issues like a stiff neck. People who sleep on their stomach with their neck turned to the side. These people, they have more headaches. They may wake up feeling dizzy. That's because there is an artery that runs to our cervical spine. This artery is called the vertebral artery. As you can see in the image, when we slightly rotate our head, this artery follows the movement. So this movement here can be strangling this artery, reducing blood flow to the brain. This is not good at all, so avoid sleeping on your stomach. A third position that should be avoided is the position where you lie on your back and raise your arms above your head. This also increases the compression of the soft tissues here that are in my joint, passing over the shoulder joint. This also increases the impact. The pinching in my joint increases the load on my shoulder, and it's a position that will make you wake up with shoulder pain in middle night and have shoulder pain the next day. Now let's look at some alternative positions for sleeping if you have shoulder pain, improving comfort. by creating supports for the shoulder. That will greatly help with your pain. The first tip I give you is that you sleep on the less painful side, to lie on the less painful shoulder. So I'm going to show you here how you are going to do. Just lie on the less painful shoulder, okay? And actually you won't lie directly on the shoulder. Actually you will push. Move this arm forward here. And then you won't be lying on the shoulder. You will simply be lying on the scapula here. So I protect this shoulder here that's less painful, or that isn't painful. Another alternative I suggest is still lying this way on the shoulder. You will take a pillow. 2 pillows here. I have 2 pillows here. And then you will create a support here for you to rest the shoulder. So leave one more or less here in this position. Place the other more or less in this position. And then I hug these pillows, okay. I can hug. Support the arm here. And then I have a comfortable position, both for the less painful shoulder and for the more painful shoulder. If you feel the same pain in both shoulders, if both are painful, then I have another alternative for you. So look at what I'm going to do now. I'm going to take another pillow. I'm going to take another pillow. Here's the other pillow I have. And what I'm going to do now here. Look, I created a channel. See, I created a channel between one pillow and the other. A tunnel, where I'm going to lightly put my arm. Inside this tunnel I created, okay. I do the same thing. I move a little further back here on my bed, so you can see better. So I do the same thing. Look, I lie down here. Look, and I move. I move my shoulder forward. I move my shoulder forward, okay. So this position is very comfortable for me. I created a channel. In words, I can distribute the weight to the head pillow, to the pillow below, and I can relieve the pressure right here on my shoulder. So it's a very valid position. And remembering that we have pain in the upper shoulder, so it also needs support with the pillows. So I just take a pillow here, take another pillow, okay. I place it more or less in this position. In this position here, and then look. I can effortlessly keep my shoulders very comfortable, okay. I can relieve the pressure from both shoulders. I can create a very comfortable support. If you are a person who turns a lot during the night, it's already kind of hard to turn in this position. But you can place a 5th pillow here behind your back, a comforter, something to support the spine. And this will make it so I don't turn so much at night. It's a very interesting position then. For those who have shoulder pain, if you like to lie on your back, even though the position I recommend is really the side position, what you can perhaps do then is to lie on your back and then your pillow. You place it in a position that you find comfortable for you. And if needed, do it on both sides. And the pillow will also be supporting the shoulder, thus improving your shoulder pain very well. Remembering that this video does not replace a consultation. They are only for educational purposes. These sleeping positions need to be combined with a treatment, perhaps, with exercises, so seek a professional you trust. If necessary, I attend to patients all over Brazil through teleconsultation. I will leave information here in the description of this video. And therefore, speaking of exercises, it's important to strengthen the shoulder muscles through exercises. I myself have had bursitis, tendinitis in the shoulder when I was only 16 years old. It bothered me a lot, and it was one of the reasons why I chose my profession. And I have prepared an educational video for you with the best exercises that I used to treat my shoulder pain. At home, simple exercises. Easy for you to watch this video. Just click here on this little button that appeared here on the side. I'll see you there. Thank you very much for watching until the end. Leave your like, subscribe to the channel, and see you next time. Bye.